In this bite size, we're going to look at the management of children's medication and look at some of the systems you can put in place to help you manage these safely. This bite-sized session should be considered in conjunction with the recently revised Care Inspectorate document Management of Medication in Daycare of Children and Childminding Services, December 2024. This guidance document is available on our website and is for daycare of children and childminding services where children may require medication. It provides information to support you to manage medication safely in your service. It should also be used to help you review your policies and procedures and to develop your medication records. Most children will at some point need to take medication while attending a daycare or childminding service. All medication administered to children should be at parents' request. Parents should not be asked to give a general permission for children's services to administer at any other time. All services should have policies and procedures in relation to the administration of medication. These should include, but are not limited to, how they will obtain and record consent, the safe storage of the medication, and record keeping. All staff should be familiar with the organisation's policies and procedures. Parents should supply any medication in its original packaging along with the patient information leaflet supplied with the medication. Authorisation to administer must be provided in writing. Consent should specify the reason, dose and time frame for administering the medicine. These authorisations should be time limited depending on the condition each medication is to treat. If medication has a when required basis, it is important that staff have a clear record of when this may be required and symptoms or triggers that the child may display when needing the medication. Staff should also be asking if any medication had been administered prior to the child arriving at the premises to reduce any risk of overdosing. It is good practice to review all consent for longer term medications at least every 3 months or at the start of a new term to check the medication is still required, in date, and that the dose has not changed. It is not recommended practice for services to purchase and keep stocks of medicines for communal use just in case a child displays symptoms of a minor ailment or allergy. This includes paracetamol and ibuprofen. Administering medication should only be given at a parent's request or at the direction of a healthcare professional in an emergency. Medication should always be supplied to the service in its original container and box, clearly labelled with the child's name. Each child's medication should be stored separately and safely, labelled with the child's name. Staff must be knowledgeable about each child's medication. Medicine should be returned when no longer needed, and services should maintain accurate records of medication received, administered and returned. All medication held by the service should be stored safely out of reach of children, for example in a locked cupboard or high shelf. Where medication requires to be stored in the fridge, it should be stored in a dedicated lockable medicines fridge, or if not available, kept safely in a domestic fridge, again out of children's reach. It may not be appropriate to keep emergency medicines, such as inhalers or adrenaline injections, in a locked cupboard, as these need to be readily available and quickly accessible to staff. It is important that all staff, including relief and agency staff, know which children require medication, where it is stored, and how to access it. When administering medication to a child, a service is required to keep accurate, up-to-date records. Medicine records should include the name of the medication, strength of the medication, whether medication is capsule, tablet or liquid, quantity of medication given and received, dosage instructions, date and time medication given, a record of who provided medication and who it was returned to. You may need to record the reason why medication may not have been given as prescribed, for example, if it was refused by the child or if the medication was not available. These records should include the name and signature of the person making the record. If medication is to be given on an as and when required basis, it is important that care staff know the symptoms it has been prescribed for. These should be recorded in the consent form. It is good practice to inform parents as soon as possible of any such medication being given to a child and why. This can be done by phone, text or email, or when the child is picked up. It's important that staff have the skills and knowledge they need to undertake the steps they are responsible for. Supporting staff could include training on how to complete medication forms correctly, or building confidence in how to ask parents for more information about their child's medication needs. All staff should be confident about their responsibilities in terms of medication. Things to consider are, for example, who is responsible for completing medication forms? Who will ensure medication is taken on outings? And who will review children's medication and allergy needs with the parents? You should also consider what will happen if someone is off or unavailable. Who is then responsible for undertaking their tasks, and how will they know they are responsible for it? This is particularly important for an unplanned absence. Consider how you make sure everyone knows exactly who and what they are responsible for. All staff responsible for administering medication should be familiar with the Services Administration of Medication policy. We have highlighted key areas from the medication guidance which should be in place and regularly reviewed. To ensure continued vigilance in monitoring medication, you should go through every step of your process to see which checks are needed. Then you should ensure dates are placed within your quality assurance calendar to support these to be undertaken. Each service is unique, and you should consider how to implement and review these steps following your own processes. Please continue to refer to the Care Inspectorate document, Management of Medication in Daycare of Children and Childminding Services, December 2024. To help support the implementation of this and any new guidance, please have a look at our ELC Improvement Hub for our latest peer group session on implementing and sustaining good practice. If you found this session useful, then please feel free to comment on X using the hashtag ELCimprove. If you would like any more information on our improvement programme, please email us at the address on the screen.